Welcome to K. Elizabeth Toasts, a podcast celebrating people who increase our quality of life. I'm your host, K. Elizabeth. Each episode is a heartfelt interview of a remarkable person making lives better through one of the 5 social determinants of health. The World Health Organization says these social determinants can impact up to 55% of our health outcomes. That's more than our lifestyle choices and medical care combined. In this episode, we are focusing on the social determinant of access to quality healthcare. Give a listen if you are in need of a dopamine hit, or if you like toast, because this toasts for you.
Hi, my name is Kim Ness, and I'm an advanced practice nurse. I'm what they call a clinical nurse specialist. We typically work in a hospital setting, but I've been here at Minnesota Oncology the past 15 years in the outpatient world.
Did you say 15 years?
15 years.
That's a good chunk of time.
I know. I've had three nursing jobs over the past 29 years. So
amazing. So you've had 3 different jobs. Were all of them, and in nursing, were all of them related to oncology?
Yep.
How did you get started in oncology?
Well, it sort of found me. I thought I was going to be an ICU nurse or an emergency department nurse, like when I was going to school. Part of that is in 1984, I was 13 years old, and my brother, who was 18, almost 19, he was a freshman at Concordia College in Moorhead, Minnesota. And anyway, he was in a motorcycle accident, and it was awful. Like the first day they were, it would be a miracle if he lived 24 hours. And he did. And he lived I think it was about 9 weeks or so in the ICU in Fargo. And anyway, he ultimately passed away. And so I think from that moment, that was the beginning of, you know what, I want to be a nurse. I want to help some other 13-year-old girl try to, make it better somehow. So the ICU nurses and the emergency department nurses were wonderful and helpful. And, my brother was in the ICU for a long time. So even as a 13-year-old, we get to know people, and, it was comforting. So I just wanted to help other people. And my first nursing job was in Minot, North Dakota, and it was on an oncology floor. And the people I connected, I think the most with were either medical patients who came to our unit frequently, or the oncology patient that came to the unit frequently, because those were the people, that you could develop a relationship with.
Yeah, because they're coming back. Yeah.
They're coming back. So I interviewed for a job at Fairview Southdale Hospital, and it was on an inpatient oncology unit. And then I just kind of stuck. And when I went to graduate school, when we were deciding what kind of, what area do you want to work in? And all my clinicals that I had chosen were all cancer related. I'm just like, I think that's where my heart is. I just want to be an oncology nurse. So that's what I've been doing for like 29 years. I don't know how that happened. It just happened.
It's striking to me that you went specifically into oncology because of the relationships that you can build. That's really beautiful.
Yeah, I'm grateful every day. I've met some amazing patients and families over the years, and I'm grateful for the opportunity to be with them, at a tough point in their lives.
Yeah. So what does an average day look like for you?
I don't know if there's an average day, but I see patients after they've been diagnosed with cancer and they have met with a medical oncologist or a gynecologic oncologist, and they devise the treatment plan. So if in that treatment plan may include chemotherapy, immunotherapy, targeted therapy. So people will meet with me. This is part of our cancer survivorship program. Usually what I do is I would, see kind of what the patient's understanding of the diagnosis and the treatment is. I would talk to them more about that and then talk about, the specific treatment. What is the goal of therapy? What are the potential side effects of treatment? What are strategies to manage those side effects? Maybe prescribe some medications to help prevent potential side effects of treatment. Basically, maybe sort of, I don't know, for a lack of a better word, maybe kind of an orientation, like,
A cancer orientation. Wow.
I know. So that doesn't sound right. I don't know what the word is, but people aren't necessarily happy to walk into our doors. It's a scary place. And so hopefully to provide a comforting environment where people feel safe as they're starting, this process. Most of my patients, I would say, would be this initial type of appointment, just kind of reviewing the diagnosis, the treatment plan, the goal of treatment, the drugs, what are potential side effects, how we're going to manage it, and also assuring that they know who to call. Another part, which today I had a lot of patients who have completed cancer treatment. So I don't want to say graduation, but patients who, had surgery, they had, in this case today, chemotherapy, and there's currently no evidence of disease. And then we kind of review, this is what happened. This is the follow-up plan, how often you need to come to the clinic, what are signs of cancer coming back. Also talking about when they need to have scans, if they need to have scans, and then healthy living after cancer. Today, I also helped a family. I helped the gentleman complete a healthcare directive. His daughters and ex-wife was also present during the discussion, so they could hear what his wishes are, which can go beyond a piece of paper. The purpose of it is if someone has a healthcare directive that they would elect someone to speak on their behalf should they be unable to speak for themselves. It's good to have discussions about this. I think if someone is healthy or if they're not healthy, just so that when the time comes when they're unable to communicate their wishes, that whomever they elect can do what that person wants, not what the family or the friend wants. So I do that as well, which is good. I think it's good to talk about our wishes. Often it can be a tough topic for people.
Yeah, no, it absolutely can. And it's not something that people want to think about, your mortality. And I think about people who you're seeing are facing their mortality in a really acute way in that moment.
It's hard. It can be hard.
How do you build those relationships with your patients so that they can feel comfortable?
I think so. I think when the environment is one piece where I usually see patients is not an exam room; it's an office. I mean, there's no exam table, and there are kind of bigger chairs. So I think that maybe is sort of setting the stage. I guess I don't think about it very often. Hopefully, I'm just creating the space, just a welcoming environment by just kind of dialogue that we have.
I appreciate that the environment is different, but I I suspect that there's something about you that makes the relationship stick and to make people feel more comfortable with you.
Thank you. I mean, I hope so. Most people who work in oncology care, the people who are here want to be here and want to serve cancer patients and families.
I would imagine that there's some really difficult things that you see in relationships that are difficult to maintain even in a medical setting.
Yeah, I think, I mean, that is true that some interactions, sure, can be harder than others. Sometimes people are mad that they're in this circumstance. Cancer just happens, and there was nothing that, the person did wrong. It sounds like everything was right. And, sometimes it just happens. So, I guess sometimes people, are mad about the diagnosis, and rightly so, and we'll still be there to support them.
You come in at a time in which people are probably maybe not the lowest, but very low. And that could be exhausting.
It is kinda hard sometimes to be an oncology provider. When I was in my 20s working evening shift at the hospital, and I probably was taking care of probably 4 patients at the time, and we'd be buddied with another nurse that probably had 4 patients, and maybe we'd be working with a nursing assistant. So, in one shift, 2 patients were my patients, and one was my colleague's patient, but I took care of 3 patients that died in this 8-hour period.
Wow.
And I just think to myself, like, my friends are out having a good old time, and I'm here taking care of, you know, 3 patients that passed away in an 8-hour shift. And so, that happens, and you're still taking care of other people, and we just put on this face like, you know what, I'm here with you right now. I mean, we may have to go into our utility room and cry for a little bit before we move on to the next thing. So that was a hard day, a hard evening shift. Something that has stuck with me my whole nursing career. So it is hard at times to be an oncology nurse. That is for sure. But on the flip side, I'm grateful. I'm grateful that I could help, and have people feel or be comfortable when they pass, but it can be tough stuff. Then you see, like today, I had a couple patients who are done with treatment. They don't have any evidence of cancer. So we hold on to these moments, right? We help people get through this.
Could you tell me a little bit about the support groups?
Sure. So I can probably talk the most about a support group that I facilitated. My role was as a nurse navigator, and kind of the biggest purpose of a navigator is, to remove barriers to care. So whatever barriers that, that the patient is experiencing. And I suppose, lack of emotional support could be one. So myself and Matt Rugberg, who is a physician assistant at colon and rectal surgery, we started the group. It was an hour and a half long, and typically we would have a speaker that the patients and caregivers would identify themes, maybe issues, or just things they wanted to hear about. So we would have radiation oncologists, colorectal surgeons, dietitians, chiropractors, acupuncturists. We had tons of different speakers for the first half an hour, and then maybe we'd have a little break time, and then the remaining hour would be support. I have one patient that probably she must have came to my first or second group. Periodically, she would come back, maybe once a year, but and just highlight like, oh my gosh, this made such a huge impact when I was first diagnosed, and I just got to come back and so I can help somebody else.
You identified a need and filled it when you were in the navigator role. And so I want to recognize that.
Thank you. It was good. I'm glad that we did it.
Are there certain instances that stand out for you that have been really meaningful in the past 29 years?
I mean, I suppose I never really take time to think of it. So I took care of a patient probably at least 20 years ago, I'll say. I met with the patient's wife recently. I wasn't quite sure. Should I bring it up? Should I not bring it up? But I took care of her husband. It really made a difference to her. Like, I remembered him. I remember taking care of them and just the human connection. Like, well, this was a long time ago. And I don't know. So that was kind of cool. Like, it came around and this was a long time ago. And
Yeah.
there was a connection. And so I think that was kind of heartwarming and maybe made me a little tearful too.
So I wanted to see if you had anyone in your life that has positively impacted your life and increased your quality of life.
Well, gee, so I would toast my family. So I would toast my mom, who is a nurse as well. She's retired now, and to my brother Eric. Eric obviously was there with me when our brother died, and Eric's also in healthcare. So our experience with our brother passing away, I mean, definitely has shaped our lives. I have a son. He's 19, Ethan. I would give a toast to him. He's, turning out to be a fine young man, and I'm excited for what the future holds for him.
Wonderful. Thank you. Cheers to Cindy. Cheers to Ethan and cheers to Eric. So now here's my toast to you for providing a roadmap in one of the scariest times in someone's life where they don't know how to move forward. For remembering patients 20 years after you've worked with them and recognizing their spouses when they come through and under your care as well. For being with people as they are actively dying, but also being with people as they're actively living and fighting for their lives as well. But most, thank you for caring and for building relationships with everyone that comes through your door. Cheers. This toast is for you.
Thank you.
Now it's time for your toast.
This toast is for Heather. Heather is the best neighbor. She's so kind, looks after our house, our plants, and our mail when we leave town. She checks on us when something seems off. Hello, front door wide open in the middle of February in Minneapolis. Gifted us countless COVID tests during the pandemic, loves on our dog, provides foster care for service dogs, keeps her little free library stocked with books for the neighborhood, and treats for our furry friends. Heather is calm and patient and just an all-around easy person to be around. We are so lucky to have Heather as our neighbor.
Now it's your turn. Honor someone who has positively impacted your life by recording your own toast at ketoasts.com. Thanks for joining us. And if you enjoyed this episode, please tap the follow button, rate us using the star button, and share this podcast with someone to keep us going. Then go toast up some bread, because every positive action is worth toasting.
We have a view, but it's probably traffic on France Avenue. But I like the cancer gig. I mean, now when I think of like ICU or emergency room, I'm like, what was I thinking? I was 13. I didn't know what I was thinking. I can't imagine doing anything else. So I guess I found the right spot.